This is the place where we can learn and make intelligent decisions to maintain and maximize our health as we age. Changing our lifestyle and changing our trajectory of our lives so that we can have the life we always wanted to have, keep us socially engaged with our community. Good news is it's never too late. Hi, and welcome to Doc's Place, where we age responsibly. I'm Susie Doc Blaylock, and today we're going to talk about knowing your numbers. And you're so disappointed, I'm sorry. I know. You're like, when are we going to get to the good stuff? And, well, I'll tell you a story about that. When I was in medical school, I was a nurse before I became a doctor. And I would sit in the first 2 years of medical school with all the book work and learning, and everybody else in the class was like, when are we going to get to the real medicine? When are we going to get to the hospital? When are we going to, lay hands on patients and do exciting things? But I sat there the first 2 years and we'd be studying something. All of a sudden I go, oh my goodness, because all of a sudden I had the knowledge that I didn't have as a nurse to understand why we had been doing things in the hospital and why I'd been taking care of patients certain ways. And as my knowledge base grew, I had the tools and the knowledge I needed in education to treat patients in a different way than I had as a nurse. I became a physician and was able to work on a different level. But all of that really had to do with the additional knowledge that I got by spending that additional time in medical school. So even though you're really wanting to get to the good stuff and how can I lose 10 pounds and start looking really like 10 years younger and all those good things, we'll get to some of that stuff. But there's really a reason that you need to go over your numbers. You don't want to live longer but not live better. So we need to know some things. Nobody wants to, live 10 years longer, but actually be in worse shape than they would have been if they'd just died early. You know that old saying, what is it? Live hard, die young, be a good-looking corpse, or you can live long and not do well the last few years and die. So we're going to do in between. We're going to do manage our health, our risk of aging, and get the best of both worlds. We're going to increase our lifespan and we're going to increase our health span. We're going to increase the quality of our health as we age so that people say, gosh, you look 20 years younger, or you act like you're 10 years younger than people your age. So those are what we're aiming for, and that's why we have to know what our numbers are. We need a baseline. You really need to know where you are right now and assess what your health is and what the risks are for you personally. Everybody has health risks, but each person has different genetics and different backgrounds and different health habits. So it's going to be different for each person. So we need a baseline look at some numbers to help us develop a good lifespan and health span. We need to have a plan for what we want to do to manage our health and what we can do to make it better, or just see if we're in good shape now and if the basic four that are the highest risk for bad life are something we need to worry about, or if ours look okay. The four things that are the major causes of death or poor quality of life, of course, are heart disease or heart attacks, strokes, cancer. Cancer's a big killer, a big detriment to a healthy life. All your neurologic things, Alzheimer's, Parkinson's, all the neurologic diseases that we see so much of. My mom had Alzheimer's. Is there anything I can do so that I don't have to worry about having the same thing she had? And then there's metabolic. Diabetes is the number one thing, but your metabolic baseline and what your metabolism is doing. I have a friend that lives in South Carolina. His name's Tank Dixon, and he runs a facility called Tank Athletics. And what he does is he trains young athletes in high school, college, elementary school that are trying to have advanced sports. And the interesting thing is, when I've talked to him, he has different approaches to different athletes. If you're a baseball player, he has some exercise moves that improve their swing speed, their running skills for getting around the base and things like that. If you're a soccer player, it's more about the feet and the ankles, and he has special just ankle exercises. He puts these kids through like a whole ankle strengthening and stretching routine to prevent injuries and improve their stop start and all that sort of thing. And football, all the different sports the kids play, he has different tailored programs depending on what their body needs to maximize for the type of swing motions or running that they use for their particular sport. And it's the same for us. We need to see where we are, what we're doing as far as our game plan, and start adding in the things that will improve our life and improve our health span. So we can have people say, oh man, you're going out swimming with the kids, you're going skiing with the kids on the lake, and you're what, 85? Well, you know, so that's what you want to be. You want to be that person. What I say to everybody is, now you'll see somebody say, man, they look good for their age. I say, yeah, that's how I want to be when I'm 120. Now they may be 70 or 80, but my thing is that's how I want to be when I'm 120. So pick your place where you want to be. Get a baseline of what your health looks like now, and then you work on tailoring a plan to optimize your rest of your life. Okay, so the first thing really that you want to do is get a family history. Look at your family tree, your mom and dad, grandmas, uncles, aunts. First of all, how long do people in your family live? If they live to 90s, then your genes are probably, helping you. If you have a family that has a lot of early onset deaths, you have some families that just have almost everybody has cancer. Somebody has cancer in the family, or families where everybody has a heart attack. My granddad died when he was in his 30s. My dad died when he was in his 40s, and I've already got one stent and I'm in 50. So there are things that you need to look at and just take stock of what is going on in your family. That'll help a lot in directing what you need to be looking for. So go through and write, look at the big four. Do you have Alzheimer's or dementia, Parkinson's in your family? Do you have a lot of diabetes in your family? Are you a family full of cancer? Are you a family with a lot of cardiovascular disease? A lot of times genetics plays in with that. It doesn't, doom you to a life of, my dad had it, so I'm going to have it. But you do need to have a look at that and decide what you need to be concentrating on as far as optimizing your health. So once you get that, the good news is like a lot of these things, the four big killers take a long time to develop. You don't just like have a heart attack when you're 50, and you had normal arteries when you were 45. You had your cardiovascular disease starting in your 20s. There's been, look at men in their 20s doing studies, and they already are starting to see cardiovascular disease, atherosclerosis, buildup of calcium in the heart and blood vessels at a young age. But that's not a significant amount and doesn't cause any problem until maybe 20, 30 years down the road, depending on your other lifestyle factors. So the earlier you can start assessing your overall health and identifying things that you need to work on, the better odds you have of taking care of that problem and helping yourself out. Heart disease, diet is like the number one thing. Smoking and high blood pressure damage the lining of your blood vessels, and they will lead to increasing your cardiovascular calcium. So smoking's just a no-go from the start. You don't you shouldn't even be listening to this if you're smoking. You got to quit. Tobacco, really, in all forms, but especially smoking. And high blood pressure. High blood pressure is the number one problem with strokes. And it also, like I say, damages your endothelial lining for your heart and blood vessels. Cancer, smoking, insulin resistance, and obesity. Those are the things that are going to increase your chances of having cancer. When you look at Alzheimer's and Parkinson's, women have a higher risk of Alzheimer's, but men have a higher risk of Parkinson's. And they think women, it probably has to do with menopause and the loss of estrogen support. And so there's a question of like, do you need to be on a female hormone replacement if you have a family history of Alzheimer's? So family history, early detection will help us live the life we want to live. We have to age responsibly. You have to you got to put some skin in the game. You're actually going to have to do some work, and not all the work's just going to the gym and walking on the treadmill. Part of it is getting your blood work done. And if you have a doctor, they can order all this blood work for you. If you're 40 and you don't have a family doctor yet, then you need a family doctor. And I'll tell you why. Even if you only see them once a year or every couple of years, you've got a baseline. You've got somebody that you can rely on that knows your history. You can get medications for any heart, diabetes, that sort of thing from your physician. And even if you don't need one and you're healthy and you can go 3 or 4 years without seeing him, you always have that family doctor. When you get to Medicare age, and a lot of you know this, when you get like to 65 and you're getting over on Medicare, a lot of physicians limit their amount of Medicare patients that they will take because they have established practices. They get less money from Medicare patients, and they will take a certain amount of their practice as Medicare, but the rest of it, they want better paying insurance. So if you get a physician when you're on regular insurance, and then you go to Medicare, they're going to keep you as a patient. They're not going to get rid of you as a patient. But if you go with Medicare and need a physician, then you're hunting around, and good established physicians are usually full and not taking many Medicare patients. So you're less likely to get the person that you want or need for your health care, in my opinion. Now, that's just my opinion. I think you're better off having somebody that you've developed a relationship with that you know is reliable and that you can transfer over. But enough of that. The nicest thing about a lot of the tests we're talking about is they're not that expensive. The bad thing about a lot of the tests we may be talking about is that your insurance doesn't want to pay for that. Medicine today is, we want to fix things that are broken, but medicine has just now starting to get back to, we want to prevent things from becoming broken. We want to keep you healthy, and that is better in the long run than having you come in with high blood pressure and already has some cardiovascular disease, and we will, give you medicines and treat you for that and test you along the way. You're better off starting early, because most of these diseases have long buildups. And if you catch them early, you can either reverse them or prevent the bad complications that if you don't start early on these diseases. And it may cost you out of your pocket, but if you're listening to this podcast, that probably means that you're interested in having a good, healthy life, and that you're willing to put some resources into that. And, you may have to skip a couple of Starbucks to get your this and that lab work done, but it'll be worth it in the long run. And you don't have to get it all the time. So the first things we'll start with are the cancer-y kind of things. Women know to get their mammograms, their pap smears. Cervical cancer and breast cancer are kind of the big thing for women. And Men, it's prostate cancer. You can get a prostate exam or a PSA exam. For men, they say 50 to 70 years, but if you have a family history, you may want to start getting that checked earlier, or if you're African American, you need to start like at 45 because African Americans have higher rates of prostate cancer. Now, there's kind of a couple of kinds of prostate cancer. One, you live with it, and one, it'll kill you. You know, there's one's way more aggressive than the other, so you need to check for prostate cancer, because you'll say, oh, I know somebody that's in their 80s and they haven't had, they have to take some medicine and stuff, but you don't want to be that person. For one thing, you don't know whether you have an aggressive kind or non-aggressive kind, and you still have to be on medications and get testing and have issues even if you live with it. I would much rather live without any kind of cancer than live with a managed cancer, even though that's better than one that will cause you early death. Colonoscopies. Okay, I can't say enough about colonoscopies. And we see this all the time, and you probably know somebody that's died from colon cancer or has had extensive colon surgery and chemo and radiation and have gone through a lot of treatment and still end up dying later. Colonoscopies are recommended really in the 40s. If you have a strong family history, you need to get one in your 40s. Now, I think your insurance probably won't pay until you're 50 unless you have a strong family history of cancer, or you have are African American. But you know, it's worth it to get the colonoscopy. Pay for the extra colonoscopy. If it's normal, you only have to have them every 10 years. And so if you get one in your 40s and you paid for that one, then, and you may have to shop around. You may have to go to a GI doctor to do outpatient. They probably do a lot of, and they can give you a cash price and things like that. But you can get a colonoscopy done, because we see people that come in and they have a few polyps and they get those clipped out, because not all polyps are cancerous, but all cancer comes from polyps. So if you go in and you see a few polyps in there, the doctor will clip those out, and he'll say, well, I need to see you. You need to repeat in like 2 years or whatever he recommends. And then you might have to have another one in 2 years and follow up. And if it's clear, they might extend that out to 3 to 5 years. But we see other people that come in and they're like 60 and they haven't had their colonoscopy screening 10 years before, and all of a sudden they've got a big cancer in there and they have to have surgery. They may or may not have to have a colostomy. They, depending on how invasive it is, we'll have to have chemo and radiation. If it's caught early as a cancer, it can be curable. If it's not caught early, it can lead to death. So it's important. The screening things that we can do to maintain our lives are just must do things. There's no sense trying to be healthy and eat whatever the latest fad spice or chemical or thing on the internet if you're not willing to take responsibility to look at your basic health markers that can be treated and can be taken care of or can prevent problems. Skin exams. It's important to get skin exams, all your skin cancers. Melanoma is the killer. Jimmy Buffett, if anybody knows who Jimmy Buffett is, if you're my age, you will. He didn't have a melanoma, which is what I thought he had. He had a rare skin cancer. So, you know, it's important to just, even if you just have like a significant other, just do a whole body check. If you've had a cancer and go to a dermatologist, they will do what they call skin checks, and they'll look at anything that looks suspicious. But you can tell if you just watch your body for anything that looks different or growing or irregular, and make sure you check basal cells and squamous cell carcinomas. I've had a friend that died from a squamous cell carcinoma on the face. He waited a long time before he ever went and had anything done about it. And by the time he did, it was in his lymph nodes, and he died several years later. And we all knew it was there. We all were like, why didn't he get that taken care of? And he finally did, but it was too late. So don't skip knowing your numbers and skip your health screenings. The other things you need to know is your blood pressure. Keep your blood pressure normal. Don't be afraid to take medicines. There's a lot of good medicines out there today that don't cause a lot of side effects. Another thing that if you're worried about cardiovascular disease is a CT scan. A CT scan is they scan your it's called a calcium score. They scan your heart arteries. It just takes about 5-10 minutes. And when I had mine done 3 or 4 years ago, it was probably $50. It may be $50 to $100. You may have to shop that. And it gives you a calcium score of how much calcium's in your arteries. If there's significant amount, then you probably need maybe a CT arteriogram where they put dye in and then do a CT and they get a good picture of your heart, or go to a cardiologist to see if you need a catheterization. But that's CT scan. It's called a calcium scan. CT score is a quick and easy way to just get a baseline. You might be 20 or 30 and have significant calcium buildup, which hasn't caused symptoms. And if you change your lifestyle when you're young, then when you get to your grandfather's age or your dad's age who dropped dead early, you will have prevented that from happening to you. Then we go to cholesterols. You always hear your HDL and your LDL, but there's really more specific cholesterol markers that are better. The ApoB, it's a protein on the LDL surface, and it tells you more than just the LDL does. It tells you how much lipoprotein that you have circulating. So that one, it's actually on the surface of the LDL, and that may be a $20, $30 test. Your doctor's going to say, well, your insurance doesn't cover it. Well, how much is it for me to get it? And you can get these tests done. You just have to pay out of pocket, but it's worth it. If you have premature heart disease, lipoprotein little a is the marker. ApoB, going back to that, that's the total lipoprotein burden. It's the percent of LDL particles in your bloodstream. LDL is the bad one. That's the one that can get stuck in your endothelium and clog up your blood vessels. But the ApoB tells you how much of that you actually are carrying and gives you a better marker than just the LDL, HDL numbers. And lipoprotein little a is the protein. It's a protein. It wraps around the LDL cholesterol, and it's worse because it makes those LDL proteins more likely to stick in the endothelium and cause vascular damage and calcium buildup. So the lipo little a is even better marker of endothelial health. Now, it depends on your physician whether they're doing those tests or not. These are relatively newer. Some people may not recommend those or be familiar with them. Usually your cardiologist, if you go and ask them that that's what you want, they will be familiar with that, and they will know. But even some of cardiologists that may not feel like that's as important as just the standard HDL, LDL, might not offer those. But if you ask, you have to be knowledgeable about your health, and you have to take responsibility for your health if you want to age responsibly. And then finally, the last few things, I really think you should get a CBC just to make sure you're not anemic, make sure you don't have any iron deficiency or B12 deficiency. That'll show up in your red blood cells on just a simple CBC. Hemoglobin A1C, that's a sugar marker that gives you about a 3-month look at what your sugars have been running. It's the glucose that attaches to your hemoglobin. Instead of just getting a spot fasting glucose, this is a better indication of where your sugar runs most of the time. So get a hemoglobin A1C when you get your lab work. Vitamin D, get a vitamin D level. You know, people say, oh, you need 600 or 800 micrograms of vitamin D. What you need is a level of at least 50. You need a vitamin D level of at least 50, maybe even as high as 100, but at least 50. And, you know, the quote recommended dose is 600 to 800. I'd have to take 7,000 micrograms to get a level of 50 or 55. So you actually need to get that measured, and you need to start on vitamin D, and you need to recheck it to make sure your levels are up with whatever dose you start with. The reason for vitamin D is it can, if it's low, it can worsen your heart disease, it can increase your blood pressure, maybe increase your diabetes or control of your diabetes, and it can also, if you get your levels good, can help cut down on stroke and MI. And most physicians are real familiar and will put patients on vitamin D, but you really need to know the blood level to make sure. I mean, if you're not going to get up to the levels that are helpful, then you might as well not take it. So make sure you get a level, and after you start taking your vitamin D, and make sure that it's adequate for what you need. Okay, and then the final thing, which is not really a test, it's your BMI. That's your body mass index. It's a height weight thing, and it gives you a better idea of how heavy you are for your size. Now, this can be skewed, especially with real muscular people. A lot of the bodybuilders, you see them, they're on stage and they're no fat on their body, but they're 300 pounds, and they get a BMI that says they're obese. Well, they have a lot of muscle mass, which may or may not be good. That's a different story, but they're definitely not obese. But as your BMI gets above normal, it increases your chances of getting metabolic syndrome. You're unhealthy. You have 3 times the risk of all-cause mortality if you're obese. And we know that obesity is high in our country. Probably 30% of people are maybe even morbidly obese. I can't remember the numbers actually, but I know at least 40% of people are overweight, and 30% or so are morbidly obese. And it becomes a real health issue because it worsens all your other diseases that you can have. So that's our talk for today. It's real important. Make sure you kind of have a baseline of where you are personally as far as your family and what diseases run in your family and how late or early people die, and make sure you get a routine blood work. I'm going to tell you one last story. I had a hip surgery a couple of years ago, and then I had the knee done. I was snow skiing in Tahoe, and I slid into a tree, and I jacked up my right side. So in January, I had my knee replaced, same side, right side. And I tell you, I couldn't do anything. I didn't go to the gym for 8 weeks. I didn't get much exercise. My mood was down. My endorphins weren't flowing like they do when I go to the gym. I was eating just kind of regular junky food. Now I've started back to the gym, and I'm still not eating as good as I should be. I've been eating a lot more junky food and not eating clean. My weight's at the high end of normal, so I haven't quite slipped over the edge and getting obese, but I'm at the high end of normal. Anyway, I get lab work done religiously. My last lab work, which is only 6 months ago, before my surgery, was all normal. And in my lab varies some, but basically it's been normal. Mostly my cholesterols, my sugars, and all the good things, liver enzymes, all that sort of stuff. And I got my lab work back. I about died. I was like, oh my goodness. My cholesterol had doubled. My triglycerides had doubled. I was number one, kind of frightened and mad at myself. And it just goes to show it doesn't take a lot of time to get off the track. You know, I knew I wasn't going to compete this year because my leg, I couldn't get enough muscle back on, so I was kind of just like taking it easy and eating things I don't usually eat. And then I was kind of feeling sorry for myself for sitting around and ate things I shouldn't eat. So just because your lab work's good today doesn't mean it's going to be good, you know, a year from now. Good lab work doesn't give you permission to just eat what you want, which I kind of thought it did. But hang in there. You can, nice thing is, you know, I can clean up my diet. I'm back at the gym and my next numbers will be better because I won't be eating the same food. But it's important to realize that diet and exercise make a huge difference on your lab work, your metabolic diseases like diabetes and heart disease, dementia, cancer. So there you go. Age responsibly. We'll see you next time. We're going to talk about exercise next week. I'll give you some scoops on gyms and some tips you might not know. So glad you are here. Stay with us. Come back. We'll see you next time.